a large number of people have joint diseases, and despite treatment, they don't see any results. They take some trendy chondroprotectors, but there's still no desired effect. Their knees keep hurting. Some even undergo surgery, have their joint replaced, and often the replaced joint continues to hurt. Strange as it may sound, the joint keeps hurting. Why does this happen? How does this happen? Let's figure it out. So all human joints, like this model of a knee joint, consist of two or more bones that together with the joint move relative to each other. And when the bones move relative to each other, at the point where they connect, they start to rub against each other, and the bones in such a place would wear down very quickly. That's why at the point where the bones connect, they are covered with a soft parta cartilage. A little cartilage meaning a soft cartilage, like for example your ear or nose, and the cartilage in this place would also wear down. That's why joints, all joints, whether small or large, are always enclosed in a joint capsule. The joint capsule seals the joint tightly, and inside the joint capsule there is synovial fluid. Synovial fluid is a special lubricating substance that is produced in the joint. And when synovial fluid is produced in the joint, it lubricates the cartilage so that when the joint moves, the cartilage doesn't rub or wear down and the joint stays healthy. It's important to keep in mind that there are all sorts of ligaments in a joint. For example, here are the cruciate ligament and the collateral ligaments. They limit the mobility of the joint, and they can be damaged in certain injuries or joint traumas. And it's important to remember that synovial lubrication in the joint is constantly produced because blood flows to the joint through the arteries. That's the structure of a joint. This is the knee joint. But the same structure applies to other joints in the human body as well. Friends, in our joints, there are really only two common diseases, arthritis and arthrosis. Arthritis is inflammation in the joint, and the inflammatory process in the joint always occurs as a result of some kind of injury. This could be a trauma. It could be a household injury, a sports injury, a work-related injury. Doesn't matter what kind of trauma it is, but trauma causes damage, and at the site of the damage, a natural inflammatory process occurs. Inflammation will be accompanied by the usual 5 signs of inflammation. It will be red, it will be hot, it will be swollen, it will have limited movement, and it will be painful. But the main manifestation, the primary sign of the inflammatory process, is swelling in the joint. As the doctor says, fluid has accumulated in the joint and the fluid needs to be drained. First of all, friends, the fluid in the joint does not need to be drained, and it can simply go away on its own if you take anti-swelling measures. Today, I am presenting a good anti-swelling method that can be used for the joint. This is myostimulation. Here in my hands, I have a myostimulation delta source of low-frequency electrical impulses. It is turned on, and when the belt is activated, low-frequency direct current electrical impulses begin to flow through the electrodes onto the surface of the body. They are safe for your health. They cannot cause harm or damage, even for those with heart conditions or other issues. But these impulses cause the small muscle fibers in the tiny veins and in the area of inflammation to contract. As a result of this contraction, the veins begin to drain fluid from the inflamed area more effectively, producing an anti-swelling effect. When we use myostimulation on the surface of our body, it reduces swelling, and as a result, the puffiness and edema go away, the compression of nerve pathways stops, the pain subsides, and consequently, the inflammatory process comes to an end. Just a few 5, 7, or 10 days of myostimulation applied to a swollen edematous knee leads to the elimination of swelling and resolves the problem of arthritis, the inflammatory process that occurs in our joints. So arthritis manifests as swelling in the joint, and it is addressed by using the physiotherapeutic procedure of myostimulation. But what about arthrosis? The very word arthrosis can be literally translated as the aging of a joint. It is a degenerative dystrophic process, but essentially it is the aging of the joint as a result of a natural age-related decline in blood supply. That is, as we age, less blood reaches the joint. But this can happen with age, or it can result from some kind of injury or from further wear and overload of the joint. But less blood reaches the joint, less blood comes in, and less synovial fluid is produced. And then when you move, the joint starts to crackle. The joint begins to creak. When the joint creaks, when the joint cracks, it means there is already less lubrication in the joint. And then the joint surfaces, the cartilage surfaces start to wear down, start to wear away. As a result of the cartilage wearing down, the thickness of the cartilage decreases. This can be seen on an X-ray, and a diagnosis such as arthrosis is made. When the cartilage wears away, the bones of the joint begin to rub against each other, and then deformation occurs. Then arthrosis turns into osteoarthritis, which in turn progresses to deforming osteoarthritis. In other words, the joints become deformed, the range of motion in the joint decreases, contractures develop, movement in the joint becomes restricted, and the joint becomes aged and, as they say, worn down and used up. But this happens at the later stages. What should be done in case of arthrosis? You need to start from the cause of the disease. The cause of arthrosis is that less lubricant is produced in the joint, because often with age, blood flow to the joint decreases. It is necessary to improve blood flow to the joint in cases of arthrosis. For this, I will now introduce another device. This is a product made from turmanium ceramic. Turmanium ceramic is a special composite material that, when heated artificially from an external source, becomes a source of heat itself, with parameters matching the warmth of the human body. In other words, it is the same as human body heat. With this kind of heat, I can warm up my body effectively and safely, and by using this material to warm my body, I can achieve improved blood circulation. And it has been made in the form of a belt. The belt is wrapped around the knees, around the hip joints, around the joints. It is set to a fairly intense heating temperature on the control panel. You set it to 50 or 55 degrees, and the joints are warm for at least half an hour or even longer. As a result of the heating, in order to maintain temperature homeostasis at the site of warming, there is a mechanical reflex expansion of the blood vessels. As a direct result, a greater volume of blood flows to the joint, and subsequently a more abundant supply of synovial fluid, which effectively lubricates the articulating joint surfaces, begins to be continuously produced from the circulating blood. And as a result of such warming, the joint stops creaking. The joint will not creak. So the expected result is our joints are creaking, we warm up the joints. As a result, the joints stop creaking and normal mobility in the affected joint is restored. So if we have arthrosis, it means the joints are poorly lubricated and creak. Then they need to be warmed with infrared heat, turmanium ceramics, and the joints will stop creaking. I repeat, there are two types of diseases in our joints. There are arthritis and arthrosis. With arthritis, there is swelling in the joint. With arthrosis, the joints creak. With arthritis, when there is swelling, you need to use myostimulation. With arthrosis, when they creak, you need to warm the joints. But what if the joints hurt? Very often as a doctor, I hear complaints that knees hurt, hip joints hurt, shoulder joints hurt. And this is the main sign of disease in the joint. This is the main complaint of patients when they report problems with their joints. So friends, this is the biggest secret that exists in our joints. Yes, sometimes joints can hurt on their own when the cartilage wears away and the periosteum is exposed. But in that case, the joint pain is sharp. Damage to the periosteum, in essence, is pain similar to that of a bone fracture. Joints can hurt on their own, but it's a sharp pain, as if the bone is broken. You know what it feels like when a bone breaks? But often we encounter a different kind of joint pain. This is a pain where a slight aching, pulling sensation appears in the joint. So, my dear friends, the joint itself doesn't actually cause any pain or discomfort. Rather, joints typically hurt when the delicate nerve roots in the spinal column, specifically in the back region, become compressed or pinched, leading to significant discomfort. And in most cases, I find that joints, knees, hips hurt because a person has pinched nerve roots in the lumbar region, or if it's the neck, in the cervical thoracic section of the spine. Here's an example. A person likes to sleep on their side. Because they sleep on their side, they twist and bend their spine. As a result, the nerve roots get pinched, and that's why the person's knee hurts. The knee is well, relatively healthy, just a bit aged. There's no disease in the knee, but the knee hurts. And this condition is called arthralgia, joint pain. And most of the time, these are exactly the problems I encounter. Knees hurt, hips hurt, shoulder joints hurt because a person has a pinched nerve in the spine. And as a neurologist, I perform a very simple procedure. I have the person lie on their back. I lift their leg, release the pinched nerve root in the spine, and immediately the knee, hip, shoulder joints, any joint stop hurting. I do this procedure a lot. I perform this procedure on people, and sometimes I do it publicly. I even record videos about this and post them on YouTube to show that if your knee hurts, it can be easily cured in a second if you address the problem in the spine. I solve this by releasing the nerve root, and people are amazed, especially those who have been given frightening diagnosis, arthrosis, coxarthrosis of the 3rd, 4th, or even 20th stage. I release the nerve root, and as a result, the person's knee and hip joint return to normal and all the pain stops. So if your knee hurts, if your hip joint hurts, in most cases the problem lies in the spine. And primarily that's because people sleep on their side. Most often, in the majority of cases, from my experience, about 95% of people who are sent for knee joint replacement surgery can actually be treated without surgery. So out of 20 knees that are operated on where the joint is replaced with an artificial one and endoprosthesis, in 95% of cases, 19 out of 20, I can manually restore such a knee to health, cure it so that it stops hurting, and do so without surgery. People are being operated on having endoprosthesis implanted instead of a healthy joint. Well, relatively speaking, but a healthy joint that can still function. The same situation applies to hip joints, but due to the presence of actual real diseases of the hip joint, the statistics there are 80%. That is, out of 5 hip joints, 4 can be treated without surgery in cases where surgery is usually performed. And surgery is not advisable when it is possible to treat without an operation. I block the nerve root and the joint stops hurting. The person gets up, walks, feels no pain, their legs move, their legs obey. Because the original problem with the joints, the pain in the joints was actually in the spine. You need to work on your spine to stretch your spine. You absolutely must change your bed so that you only sleep on your back. So let's sum up. There are only 2 types of diseases in our joints. There is arthritis and there is arthrosis. With arthritis, there is swelling in the joint. With arthrosis, the joints crackle. For arthritis and swelling, you need to do myostimulation for the joints. And then thanks to myostimulation, the swelling stops. If a person has arthrosis and their joints crackle, in order to stop the crackling, the joints need to be warmed up. This stimulates the release of synovial fluid, and then the joints stop crackling. But if your joints hurt, don't focus on the joints themselves at all. The problem isn't in the knee, not in the hip joint, not in the shoulder. The problem is in the back. In that case, do spinal traction. There is traction massage equipment available for this purpose. And be sure to change your sleeping conditions. You should only sleep on your back, and to do that, you need to sleep on a firm surface. Well, that's the information I had for you today about joint diseases.